When we look at the knee, a lot of times we talk about how the knee is more unstable in a female than a male. And so the question we've got to ask ourselves is why? Well, there's several reasons. One of the reasons is this idea called the Q angle, all right? So when we talk about forces, a great way to load forces would be in a vertical manner. Why? Because you're placing one load directly on top of the other. But unfortunately in humans, at the knee, when we're looking at the ratio between the femur and the tibia, we don't have a vertical alignment, we have an offset pattern. So the Q angle theoretically is the angle that exists between the femur coming down and the tibia. So if your tibia is vertical, because of your hips, the femur is going to be at a slight offset. And that difference in the angle, so follow the long axis of the femur and the long axis of the tibia coming straight up, that deviation in that angle is called the Q angle. And generally on females, it is more pronounced than it is on males. For obvious reasons, women have wider hips for childbearing purposes, but they're also shorter in stature, which means their bones are shorter. That makes the angles more pronounced. And so that angle generally on females, it's estimated to be an average of around 18 degrees, whereas on men, it's much smaller, around 12 to 13 degrees. But obviously, it's going to vary from person to person. What we have on this knee right here is, you can see the tibia right here, and this is called the tibial plateau. So the tibial plateau is the surface upon which the femur sits, and that's all your mass coming down. While in males, it's pretty wide and flat. But in females, it's a little narrower and rounded, which means there's actually less contact area, less congruency between the load of the femur and the rest of the body on top of that tibial plateau, which makes it more unstable. Then you also have to think, if I use my fingers and I do a rotation like this, if you call this one finger 1 and this one finger 2, I think we can all agree that this finger is actually moving faster than this finger, because the definition of velocity is the change in distance over time. Well, my fingers are starting in one position and reaching the same end destination at the same time, but this one had to cover more distance. Now, if you think of walking, remember the heel strikes and the foot drops. As you supinate, the femurs roll out, and as you pronate, the femurs roll in. And so think of walking. As you're walking, every time you're hitting and the foot's doing that, your femurs are rotating. But because of this distance, like I just showed you, it means the tibia is actually rotating more slowly than the femur. The femur is further away from the point of rotation, which is the foot. And so if you've got two bones rotating at different speeds, there's a little bit of twisting between them. Now what we have, and you can kind of see it very closely here, is right here you have a little groove or a little notch called the intracondylar notch between these two condyles on the femur. And right through this notch is where your two cruciate ligaments, the crossing ligaments, run. But what's happening in the foot is you're getting this twisting. And the problem it creates is when we look at the difference between men and women, is that women have a very narrow and deep intracondylar notch, whereas men's are shallow and wider. And when the bone is twisting, what's happening is those ligaments in a female are passing through a very tight notch, and so there's a bit of shearing that the ligaments are rubbing against the bone. So if a woman has a lot of rotation, it's going to start to shear on that ligament. Think of a strap. If you're rubbing a nylon strap over the edge of a table, eventually it starts to wear itself down. And that's another reason why we also see some increases in knee injuries in females. So we have the tibial plateau, we have the intracondylar notch, we have the Q angle, all right? You also got to consider men usually are larger in stature, so they have larger bones, bigger muscles, they got a lot more surface area for attachments and for stability. But then there's also a hormonal difference. The hormone relaxin, for example. Relaxin levels are high, it creates a lot more joint laxity, which means the joint is less stable, which means, again, the female is more prone to injury. So those are some of the physiological reasons why we see that generally females could be anywhere from 2 to 6 times more likely to suffer a knee injury than her male counterpart. Most of the injuries we're talking about are Non-contact injuries, generally it's a jump, landing, turning, twisting, cutting mechanics. So it happens a lot in athletes playing soccer, maybe volleyball, basketball, things of that nature.